Good afternoon. Thank you, Governor, for those updates. Thank you for your words of encouragement and tremendous leadership. As the Governor said, we have 97 new positive cases. This brings our case total to 806. Sadly, we have 3 additional fatalities. 2 of these individuals were in their 80s. One of these individuals in their 80s was a male, and the other a female. The female in her 80s was a resident of Golden Crest Nursing Center. The total number of COVID-19 associated fatalities related to Golden Crest is now 6. The 3rd person who passed away was a male in his 90s. This person was not a nursing home resident. We are continuing our close partnership with nursing homes throughout Rhode Island and with the Rhode Island Healthcare Association, which is the professional association for nursing homes in the state. The nursing home partners with the Department of Health and all state agencies are doing everything, working together to protect and respond to the needs of this precious population. One of the things that makes large numbers of cases in a nursing home very challenging is that you're talking about people who are often extremely medically and physically fragile. That goes for people who have COVID-19 and people who do not. As I mentioned, however, state officials and nursing home administrators and the staff directly caring for these residents are doing everything we can to limit contact in these facilities, to ensure that ill residents are isolated and cared for, and ensure that all residents are being monitored closely in an extremely vigilant way. We are also exploring a range of other opportunities to support residents and facilities. We will continue to keep you updated on those options as they progress, knowing how critical this is. I also want to take a few words to update you on the Women, Infants, and Children program, WIC, because we received a question about WIC yesterday. At the federal level, WIC is offering greater flexibility in the types of foods available to people enrolled in the program. Foods still need to meet certain nutrient requirements, but substitute foods have been added to help ensure that people can get the food they need. The state has communicated this information to WIC vendors, and WIC local agencies are providing services to all of those who qualify by phone, as well as providing services through mailing benefits. We're also adding benefits to e-WIC cards for those in participating pilot sites. WIC is not conducting in-person appointments so that we can ensure the safety of staff and participants, but we want to continue to make sure that WIC services are available to all those in need. Separately, I want to reiterate a message we've been sharing for a few days now that adds to what the Governor shared. Testing is open and available for anyone in Rhode Island who has symptoms. I can re-emphasize that the test for COVID-19 works best in terms of its accuracy when it's done on people who actually have symptoms that are present. As the Governor has been saying, we have worked very hard to expand our testing capacity and to continue to make sure that it expands as we need it to be. So now we want to continue to encourage people who are feeling symptoms to call their healthcare provider and get set up to get tested. We understand that this is a slight change in the messaging you've been hearing from us, because previously we were limiting testing to nursing home residents and other congregate settings, to people in the hospital, and to healthcare workers. But now we want to make sure it's clear that this has changed, so people can certainly understand the guidance that we are now updating. Any Rhode Islander who has symptoms can now get tested. It's important to again highlight the types of symptoms that can occur with COVID-19. These symptoms include fever, chills, cough, shortness of breath, muscle aches, runny nose or stuffy nose, sore throat, headache, vomiting, or diarrhea. It's also important to remind that sometimes you can have one or two of those symptoms as opposed to having all of them required. If you have any question about it, we know that COVID-19 is widespread in the community. Do not hesitate to call your healthcare provider to get set up to get tested. As has been mentioned, if you don't have a healthcare provider, you can still call an urgent care center so that they can get you connected to getting tested as well. We want to make sure that everyone has access to this, and we are also doing tremendous work to expand our contact tracing program to help identify all the contacts of anyone who has had symptoms. Because it's important to know if you have symptoms, you need to continue to self-isolate. Stay at home if you're sick. That's the #1 message we have been saying. But if you have symptoms, being able to tell those around you, either in your household or those who have had close direct contact with you, that they also need to quarantine at home and monitor themselves for developing symptoms as well. As our contact tracing program expands, we will want to be in contact with those folks as well so that we can help support the monitoring process and be able to respond quickly if symptoms develop. Lastly, I want to reiterate the face covering announcement that we made yesterday. We are now encouraging Rhode Islanders to consider wearing cloth face coverings in public. A cloth face covering should cover your nose and your mouth. It could be a t-shirt, a bandana, or something else from home that you can wrap around your lower face and achieve the covering of your nose and mouth. It's important to remember not to share that face cloth covering with anyone else. The one that is for you should only be used for you. We also talked about the fact that you can wash the face cloth covering after each use or at least once a day. On a cooler day like today, the face cloth covering could be as simple as a scarf that you pull up to cover your nose and your mouth. We're making this recommendation to reduce the release of infectious particles into the air when people speak, cough, or sneeze. So it's more so preventing the person wearing the face cloth covering from releasing those particles into the air. To clarify, these are not medical grade face masks, surgical masks, or N95 masks that we are talking about. We are talking about homemade face coverings. We need to ensure that the medical grade face masks are reserved for healthcare professionals and other critical infrastructure workers who need that to be able to protect themselves in their work settings. The homemade face coverings are what everyone else in the public is available to use. A last important point I want to make is that these face cloth coverings are not substitutes for physical distancing that we have been requiring, for washing your hands frequently, for staying home when you're ill, or for following any of the stay-at-home order requirements that have been mandated. Those are critical. Just because you are wearing a face cloth covering, that does not mean that you can go out into the community with symptoms. The face cloth covering may not be adequate to protect those around you from being exposed. So it's critical to know these face cloth coverings only are for situations when you're going out into the public and you don't have symptoms. If you are ill with any symptoms, you must stay at home.